Before we begin the course, please take a moment to review this important notice.
Course description. Every person experiences aging, though each of us ages differently. This course explores the physical, emotional, and spiritual changes that occur with aging. Detailed physical symptom changes are discussed. Suggestions are provided for direct care staff to assist residents as aging processes occur. Course objectives. By the end of the course, the participant will be able to, number 1, define aging, 2, list common changes experienced by nearly everyone during the aging process, 3, contrast the common myths and facts about aging, 4, briefly discuss the purpose and function of each of our body's physical symptoms, number 5, explain the common changes that occur with aging for each of the physical systems in our body, number 6, name care tips that direct care staff can perform to help residents maintain their health and functional abilities. Course outline. What is normal aging? How we age? Common myths and facts about aging? Physical changes that occur as we grow older, including care tips to assist residents. Video content. This course contains information in several short videos. The content contained in the videos is in addition to the written text. It's strongly recommended that you have speakers on when viewing the videos. The text in this course is also narrated. You will need to have your speakers on if you wish to hear the narrator read and comment on the text material. Terminology used in this course. Several terms related to resident care are used throughout this course. While most of these terms are commonly accepted in the industry, there is some variation from state to state and within different organizations. For ease of reading, we use commonly used terms in this course and clarify below the equivalent terms used in other states. Community. The term community, using a capital C, is used to describe the assisted living or residential care setting. The terms facility, agency, or others are used in state regulations. We use the term community to emphasize the home-like atmosphere of the care setting. Administrator. The term administrator is used to describe the person responsible for the everyday management decisions in the community. In many states, this individual is referred to as manager or operator. Direct care staff or caregiver. This is the person providing the direct care to residents. Although there are exceptions, typically this person is not a licensed medical professional. Resident. The resident is the individual receiving care. In other healthcare settings, the term patient or client may be used.
Let's talk for a moment about quizzes and what we call check for understanding.
What is normal aging? What is aging? The process of aging is a continuum of changes progressing throughout the individual's life. The aging process affects everyone. We all will age. However, how the aging process occurs is different in each person, so the rate of normal aging can vary widely. Aging is a multidimensional process of physical, psychological, and social changes. Some people use the term senescence to describe the process of aging or aging itself. Aging theories. No one theory can explain all the changes of the aging process. Most gerontologists, who are people who study aging, feel that aging is the cumulative effect of the interaction of our genes, the environment, and how well we take care of ourselves. So you'll see in this diagram genetics, lifestyle habits, and the environment can explain the process of aging. Aging changes. Human aging causes a wide range of changes in our body that limit our normal functions, and we become more susceptible to disease. No one dies of old age. We die from a system, tissue, or organ that fails. You can think of it as the weakest link results in death. Research on people who live long lives, such as people over 100 years old, suggests that these individuals age uniformly without a prominent weak link. Life expectancy. Even though our human life expectancy has increased over the years, the maximum lifespan that people typically live to has remained constant at 90 to 100 years. Arbitrarily, the aged or elderly population is defined as persons aged 65 years or older. Normal aging. Normal aging is not always accompanied by illness, injury, or disability. When a person ages, their quality of life does not have to decline. Our job as direct care staff and administrators is to encourage those activities that promote quality of life for our residents. Effects of aging. The effects of aging and changes in the body take place over many years, allowing the person to adjust to their new lifestyle. Remember, we cannot avoid getting older, but the rate of how our body ages will vary greatly among individuals. How we age. Unlike the changes of our childhood and teenage years, which are predictable to within a few years, each person ages at a unique rate. Some systems begin aging as early as age 30. Other aging processes are not common until much later. Although some changes typically occur with aging, they occur at different rates and to different extents. There is no reliable way to predict specifically how a person will age. Even though people age differently, some common changes are experienced by nearly everyone. These include sensory changes. Nearly everyone will experience changes in sight, hearing, touch, taste, and smell. Cognitive abilities. Nearly everyone will experience a steady rate of natural decline in cognitive or thinking and reasoning abilities. However, the elderly still can learn and retain new information. This decline in cognitive abilities is not dementia. Dementia is a disease process that affects the brain. Physical strength. Nearly everyone will have a natural decline in muscle quantity and strength. However, appropriate exercise can greatly modify the decline. Total muscle mass decreases by nearly 50% for people between the ages of 20 and 90. On average, people lose about 30% of their strength between ages 50 and 70, and another 30% of what's left per decade or every 10 years after that. Generally, people lose about 1% of their lean muscle mass per year after age 40. Disease. The risk factors for developing many diseases increases with age. Many diseases are interrelated. For example, arteries get stiffer with age, and stiffer arteries increase the risk for cardiovascular or heart and blood vessel diseases. And personality. An adult's personality doesn't change much after age 30. If a person was cheerful at 30, he or she is likely to be cheerful at 80. Myths and facts about aging. Myths about aging. Next, let's take a look at some common myths and the facts about aging. Myth: aging causes a decline in intellectual abilities and learning. Fact: some loss of brain cells occurs with aging. However, it has a negligible effect on the brain's ability to function. In fact, reasoning, vocabulary, and other skills often improve with age. Older persons may experience a decline in the speed in which learning occurs. The brain's ability to function remains best when it is used regularly. Myth: older people are not interested in nor are capable to perform sexual activity. Fact: sexual needs, desires, and functioning do not change abruptly with age. For most people who have enjoyed an active sexual life, the desire and capacity for sexual expression continues. Myth: all older people will experience urinary incontinence or the inability to hold urine. Fact: urinary incontinence is not inevitable in later life. Urinary incontinence affects only 15% of older adults living at home. In fact, 80% of urinary incontinence cases can be cured or significantly improved. Myth: older workers are not as productive as younger workers. Fact: performance may decline with age if physical strength or speed is important. However, older persons can be more dependable, have lower turnover rates, have fewer absences and accidents, show better judgment, and may be more productive than many younger workers. Myth: it is normal for older people to be depressed. Fact: depression is not a normal part of aging. Emotional experiences of sadness, grief, response to loss, and temporary blue moods are normal. Persistent depression that interferes significantly with the ability to function is not. Depression in the elderly is also frequently confused with the effects of multiple illnesses and the medicines used to treat them. Myth: if an older person has a chronic disease, he or she cannot do anything about it other than take medication. Fact: lifestyle is very important in the development and treatment of chronic illness. Exercise can strengthen the cardiovascular system, increase muscle strength and tone, and lower blood pressure. Exercise can also contribute to increased flexibility and a positive attitude. Lifestyle habits and behaviors remain important during later life to minimize many diseases. Myth: personality changes with age. Fact: personality patterns persist throughout life. If a person has been easygoing and fun-loving throughout life, the person is most likely to remain the same as he or she ages. In fact, dramatic personality changes can be the sign of serious conditions such as dementia. Facts about aging. According to the April 2009 National Vital Statistics Report by the Centers for Disease Control, life expectancy in 2006 was 80.2 years for women and 75.1 years for men. Two factors, longer lifespan and aging baby boomers, will combine to double the population of Americans aged 65 and older during the next 25 years. Good medical care, technology, and improved living conditions all contribute to a longer, healthy, and productive life. The major causes of death have shifted from infectious diseases like pneumonia to chronic diseases and degenerative illnesses like cancer and heart disease. Today, about 80% of older Americans are living with at least one chronic condition. Three behaviors, smoking, poor diet, and physical inactivity, are the root causes of over a third of U.S. deaths. The components of successful aging. Given that all persons will age, though at different rates, what are the components of successful aging? The consensus among seniors is that the following are most important: good health, high mental and physical functioning, active engagement with life, including an active social life. Direct care staff have an important role. Direct care staff have an important and vital role to assist our residents to continue to experience these three components of successful aging. The care tips throughout this course provide suggestions on how to help residents continue to enjoy successful aging and maintain a high quality of life. Aging. Now that we have taken a look at some of the myths and facts about aging, in the next section we are going to take a look at the common changes that happen within each of our body's systems. Changes in body systems as we age. Changes with aging. In this section, we're going to discuss the changes that occur in each of our body's physical systems as we age. As we discuss these specific changes, it's important to remember that everyone ages differently. For example, an elderly professional ballet dancer who has spent years becoming very flexible may be more flexible at 70 years old than a young weightlifter who simply bulks up with no flexibility training. Despite the great differences among us, research shows some predictable changes that every person will experience to some degree. For example, we will all get wrinkles in our skin. Some people wrinkle sooner, or some get more wrinkles than others. In addition to the changes that occur with age, this section will also provide direct care staff with tips to meet the challenges and needs that these aging changes present for elderly persons. Knowing this information can help administrators and direct care staff provide the best care possible to your residents. Physical changes with aging. Physical changes with aging occur in each of our major body systems. We will discuss each of the following systems in the order listed below: nervous system, endocrine system, immune system, circulatory system, musculoskeletal system, sensory system, digestive system, respiratory system, urinary system, and integumentary system. Changes in body systems as we age. The nervous system. Our nervous system contains a network of specialized cells that communicate information about our body and our surroundings. For example, our nervous system communicates when we are hungry, hot or cold, tired, etc. It also communicates to tell us to catch a ball or to lift our feet to go upstairs. Our nervous system is made up of two parts: the central nervous system, which includes the brain and spinal cord; the peripheral nervous system, which is responsible for the remainder of the body. The peripheral nervous system has two parts: somatic nervous system, that is responsible for coordinating the body movements and also for receiving external stimuli. It is the system that regulates activities that are under conscious control. The autonomic nervous system, that is responsible for controlling many of the body processes we almost never need to think about, like breathing, digestion, sweating, and shivering. As people age, their brain and spinal cord lose nerve cells and weight. Brain weight starts to decline between the ages of 45 to 50 and decreases 8 to 11% from its maximal weight in young adulthood. Does this mean that older persons are less smart? No, there is little evidence that reduction in mental competence is correlated with the reduction in brain weight. Many elderly persons remain very intellectually sharp. Changes with age are most prominent in the area at the back of the brain, mainly responsible for balance and dexterity of movement. Thus, older persons may have more difficulty with balance and agility. Remember, these changes are not the same in everyone. Some people have many physical changes in their nerves and brain tissue. Others have few changes. In general, nerve cells may begin to transmit messages more slowly than in the past. Thus, reaction times may be slowed. For example, answering a question or swinging a baseball bat. Some slight slowing of thought, memory, and thinking seems to be a normal part of aging. Although these changes are natural, many people have misconceptions about the type and extent of these changes. Sometimes people mistake the slowing of thought as confusion. Dementia and severe memory loss are not normal processes of aging. It is a result of a disease process. Here's some care tips to help with memory. There is some evidence that both physical and mental exercise can help maintain thinking abilities. Reading, doing crossword puzzles, and engaging in stimulating conversations, as well as ordinary physical exercise, may all help keep your brain as sharp as possible. So keep residents mentally active and involved in current events. Provide instructions in shorter chunks. Repeat short instructions as needed. And use visual clues. Other age-related changes in the nervous system. With a reduction in nerve cells and slower nerve conduction, the reflexes are slower and cause a slower response to stimuli. If an elderly person slips, he or she is more likely to fall than a younger person. The message telling the brain that he or she has slipped travels slowly. The message from the brain needed to prevent the fall also travels slowly, thus the person falls. Age-related changes, sleep. Changes in the nervous system can create changes in sleep patterns. Most people find that as they age, they have a harder time falling asleep and that they awaken more often. Insomnia is one of the more common sleep problems for the elderly. Sleep occurs in multiple stages. The sleep cycle includes dreamless periods of light and deep sleep with occasional periods of active dreaming. The sleep cycle is repeated several times during the night. As a person ages, less time is spent in deep, dreamless sleep. Older people average 3 or 4 awakenings each night, with increased recall of being awake. Awakenings are related to less time spent in deep sleep and to factors such as need to get up to urinate, anxiety, and discomfort or pain associated with chronic illnesses. Total sleep time remains the same or is slightly decreased, 6.5 to 7 hours per night. Some care tips to help with sleep. Residents tend to go to bed early and get up early. Snacks should be available during nighttime hours. Encourage physical activity during the day. Discuss medications with the resident and his or her physician to determine if the side effect of a medication may be interrupting sleep. If the resident has dementia, such as Alzheimer's disease, the resident may be suffering from sundowning. This is a condition in which the resident becomes agitated and restless late in the day or evening. Some common diseases of the nervous system include Alzheimer's disease, dementia, Parkinson's disease, and tremors. Changes in body systems as we age, the endocrine system. The endocrine system is a system of 8 major glands that function to regulate many of the body's activities. The endocrine system produces hormones. The hormones they release influence almost every cell, organ, and function in our bodies. The diagram in this slide shows the major endocrine glands in the male and female. Hormones work slowly and affect growth and development, metabolism, including digestion, elimination, breathing, blood circulation, and maintaining body temperature, sexual function, reproduction, and mood. As a person ages and hormones change, many things occur. A loss of muscle tissue and skeletal or bone mass, a decrease in sexual activity, menopause in women, which creates many hormonal-based changes, and many other functions that are regulated by hormones. Whether hormonal changes control the pace at which aging happens or are a consequence of other changes in the body is unknown. Common diseases. Diabetes is the most common endocrine disease in the United States. Thyroid disorders are another common endocrine system disease. Many of the endocrine system changes with aging are thought to contribute to other problems or diseases, such as obesity, high cholesterol, and hypertension, which is high blood pressure. Some care tips for diabetes. Helping a resident monitor and regulate his or her blood sugar is very important. Assist the resident to take blood sugar readings as recommended by the physician. Timely administration of medications to control diabetes is very important. Regularly and carefully check the feet of diabetic residents as high blood sugar can damage nerves and blood flow. Assist the resident to follow a prescribed diet as recommended by his or her physician or dietitian. Encourage physical exercise per the doctor's orders. Regularly and carefully check the feet of diabetic residents as high blood sugar can damage nerves and blood flow. Assist the resident to follow a prescribed diet as recommended by his or her physician or dietitian. Encourage physical exercise per the doctor's orders. Changes to body systems as we age, immune system. The purpose of the immune system is to protect the body from disease. The immune system is made up of special cells, proteins, tissues, and organs that protects against disease by identifying and killing bacteria, parasites, viruses, fungi, infected cells, tumors, and other invaders to the body. And some of these are shown in the diagram on this slide. Immunodeficiency disorders occur when the body's immune response is reduced or absent. Age-related changes. As a person grows older, the immune system loses its ability to fight off infections. This increases the risk for getting sick. The immune system's ability to detect and correct cell defects also declines. This increases cancers associated with aging. Later in life, the immune system also seems to become less tolerant of the body's own cells. Sometimes an autoimmune disorder develops. The immune cells attack one's own normal tissues in certain organs or other areas. Inflammation. Inflammation is a process by which the body's defense system uses white blood cells and chemicals to protect us from infection. Aging affects inflammation and wound healing, so older people heal more slowly. This may be directly related to changes in the immune system, or it can be a result of other problems such as diabetes or arteriosclerosis. Also, many older people take anti-inflammatory medications to control conditions such as arthritis, which may slow wound healing. Care tips, immune system problems. Encourage seasonal flu vaccine if the physician approves. Monitor for and report wounds, skin tears, etc. Monitor and report signs and symptoms of infection. Observe the resident for confusion, as that can be an indicator of infection. Changes in body systems as we age, cardiovascular system. The main components of the circulatory system are the heart, blood, and blood vessels. The cardiovascular system is an important transportation system. The heart pumps blood that contains oxygen and nutrients to feed the body's cells. On the return trip, the blood picks up waste products so that the body can get rid of them. Age-related changes. All vital organs, including the heart, begin to lose some function with age. Most people do not notice this loss because we seldom need to use our organs to their fullest capability. For example, the heart of a 20-year-old is capable of pumping about 10 times the amount that is actually needed to preserve life. Even though the loss is gradual and often unnoticed, aging changes in the heart and blood vessels do occur. As a person ages, the following changes in the heart and blood vessels occur. The heart muscle becomes less efficient and pumps with less force. The arteries narrow and become less elastic or stiffer. A weakened heart has to work harder to pump blood through narrowed vessels. Narrowed arteries cause less blood flow, and less blood flow causes poor circulation. Reduced blood flow can also reduce blood flow to the brain. This can result in dizziness, especially going from sitting to standing, which increases risk of falls. Care tips help with dizziness. Remind residents to get up slowly from sitting or getting out of bed. Report dizziness to the physician. Sometimes medications can cause or make dizziness worse. Care tips help to maintain the cardiovascular system. Encourage residents to exercise per physician's orders to maintain health and well-being. Moderate amounts of daily exercise help stimulate circulation. Encourage walking, jogging, bicycling, swimming, chair aerobics, or any other exercise that a resident can do safely and is approved by his or her physician. Exercise can also help prevent the formation of thrombi, which are blood clots in leg veins. Residents who are confined to bed can benefit from active or passive range of motion exercises, and you will certainly want to see if the physician or physical therapist has recommended these exercises. And make sure the resident eats a heart-healthy diet. You may be working with your dietitian in your building. Residents who are confined to bed can benefit from active or passive range of motion exercises, and you will certainly want to see if the physician or physical therapist has recommended these exercises. And make sure the resident eats a heart-healthy diet. You may be working with your dietitian in your building. Common diseases. Some common diseases of the cardiovascular system include high blood pressure, heart attack, stroke, heart failure, which is an inability to pump sufficient blood flow, and atherosclerosis, which is sometimes called hardening of the arteries.
When caring for a resident with cardiovascular disorders, the most important thing you can do as a care provider is to monitor that resident. If you notice they're having increased shortness of breath or fatigue or significant change in weight, particularly weight gain, we'll want to let that physician know right away. We'll want to encourage the resident to follow their physician-prescribed diet. It may include low-salt, low-fat foods. The right amount of activity is important. Make sure you clearly understand from the resident service plan how much activity that resident is to do each day. If the resident is not moving around at all, you may need to encourage them to take a little walk and move around a bit with you. Some residents may tend to overdo it, and you may need to temper their activity somewhat. So that's why it's important for you to know what the physician has ordered for that resident. If a resident uses nitroglycerin, make sure there is a fresh and adequate supply in the facility at all times. Make sure you clearly understand how the resident is to use that nitroglycerin, because even if they self-medicate, in times of panic or feeling frightened, a resident may need reassurance from you on following the appropriate instructions. If your resident suffers from hypertension, it's critically important that their blood pressure is monitored regularly, whether that is going to the physician for monitoring or maybe someone in the facility is taking their blood pressure and reporting that to the physician. Remind the resident that if they have hypertension, that over-the-counter medications can have a significant effect on their health. They should never take over-the-counter medications without a physician's order. Additionally, we want to make sure the resident is getting their antihypertensive meds exactly as ordered, on time. Once in a while, when a resident is started on new antihypertensive medication, they may have trouble feeling a little dizzy or lightheaded, especially upon standing. If this is the case, we'll want to remind our residents to not stand up too quickly. If they're going to get out of bed, for example, to sit up, rest on the edge of the bed for a few minutes before beginning to ambulate.
Changes to body systems as we age. Musculoskeletal system. The musculoskeletal system includes the bones, muscles, cartilage, ligaments, tendons, joints, and other connective tissue. Our musculoskeletal system is the foundation of our form, gives us stability, provides the ability for movement, and protects vital organs. Age-related changes. Bone mass or density is lost as people age, especially in women after menopause. The bones lose calcium and other minerals. This causes a decrease in bone strength and brittle bones that break easily. The diagram on this slide shows a normal bone versus an osteoporotic bone. Lean body mass decreases, caused in part by loss of muscle tissue called atrophy. The rate and extent of muscle changes seems to be genetically determined. Muscle changes often begin in the 20s in men and in the 40s in women. Even so, many elderly persons continue to have a full active life. Many people in their 70s and 80s still participate in athletic competitions. This diagram shows normal bicep muscles and then a decrease in biceps due to muscle atrophy. The muscle fibers shrink, and lost muscle tissue may be replaced with a tough, fibrous tissue. This is most noticeable in the hands, which may appear thin and bony. Muscle and nervous system changes cause muscles to have reduced tone and ability to contract. Muscles may become rigid with age and may lose tone even if exercised regularly. Care tips: loss of muscle and bone strength. Be aware that residents typically will have less strength and less stamina, so remind them to not overexert themselves. Be proactive to help prevent residents from falling. Turn residents in bed very gently and carefully. Help residents get out of bed and assist them when they are walking if necessary. Assist and remind residents to use ambulatory aids if applicable. More care tips include activities, exercise, and a good diet can help minimize loss of bone and maintain muscle strength. So encourage residents to be active and participate in activity programs. Encourage walking and range of motion exercise, certainly with physician approval. And provide a well-balanced diet with optimum levels of protein, calcium, and vitamins. Other musculoskeletal changes include joints become stiff and painful. Hip and knee joints become flexed, which causes a gradual loss of height and strength and a decrease in mobility. Vertebrae shorten. People typically lose about 1 centimeter, which is about 4/10 of an inch, every 10 years after age 40. Height loss is even greater after 70 years old. Care tips: loss of flexibility. Be careful when working with residents who may have a limited range of motion and are less flexible. Overextension can be painful and cause damage to muscle and connective tissue. Encourage residents to complete everyday activities. For example, bending over to tie a shoe helps to maintain the flexibility in those muscles and joints used. As people move into middle age, fat tissue may increase toward the center of the body, especially around the abdominal organs. The amount of body fat may increase by as much as 30%. Men often gain weight until about age 55, then begin to lose weight. This may be related to a drop in the male sex hormone, testosterone. Women usually gain weight until age 65, then begin to lose weight. Weight loss is, in part, caused by a loss of muscle tissue. The typical appearance of the face and neck changes with age. Muscle tone may be lost, causing a flabby or droopy appearance. The jowls may begin to sag, leading to a double chin in some people. In some people, the nose and ears lengthen slightly and may look more prominent. The skin may thin, become drier, and develop wrinkles. Although wrinkles and colored spots are inevitable to some extent, sun exposure is likely to increase the likelihood. The skin around the eyelids becomes loose and wrinkled, often making a crow's feet pattern. The eye socket loses some of its fat pads, making the eyes look sunken and limiting eye movement. Drooping eyelids are fairly common, occasionally limiting vision, and the lower eyelids may appear baggy. Common diseases. Some common diseases of the musculoskeletal system include arthritis and joint pain, osteoporosis, spinal problems creating neck and back pain. Summary, Module 2. Part 2 of this course on aging changes and considerations is continued in Module 3. In this module, we discussed how we age and the myths and facts about aging. We also discussed the changes that occur with aging in 5 of the major systems. In the next module, Part 2, we will discuss the changes that occur with aging in 5 additional major body systems.